Hey guys, this is Dr. Lindow at Warner Orthopedics and Wellness in Baton Rouge, Louisiana. I also have an office location out in Zachary, Louisiana as well. I want to talk to you today about a procedure that I'm currently doing for bunions called the LAPIPLASTY or 3D bunion correction. LAPIPLASTY is a three-dimensional approach to treating bunion deformities. Most bunions are actually a three-dimensional problem. And what's going on is the first metatarsal and the big toe tend to drift laterally. The bones tend to rotate as well as also move up and down. Traditional 2D bunion surgeries, which are what most physicians are doing right now, do not correct the toe and the metatarsal in all three planes, which is why they tend to fail, and that can actually happen up to 70% of the time, okay? The LAPIPLASTY procedure, which we're doing, corrects the bunion in all three planes and reduces the chance of recurrence down to about 3 to 5%, okay? I'm gonna show you a little bit more about it right here, and I'm gonna explain it a little more so you can understand why 3 dimensions and why fixing a triplanar deformity is so important. So I like to think of it as the Leaning Tower of Pisa. So if you take a look, this is a typical bunion deformity right here. Where you have a increased what's called intermetatarsal 1-2 angle, which is the angle between the first and second metatarsal, and then you see how the big toe tends to abduct. If you look at the Leaning Tower of Pisa, that is a very good structural similarity to what a bunion deformity would be. So the typical procedures that are being done right now, one of them is simply shaving off the bump, so to speak, as well as the more common procedure, which is called the Austin bunionectomy or a first metatarsal osteotomy. And what happens with that is you actually make a cut in the first metatarsal and you shift the first metatarsal head over. Now, if you take a look at this from a structural standpoint, look at how they did it with the Leaning Tower of Pisa. What that does is that basically moves the head of the metatarsal over. The problem with doing that is that creates an unstable foundation. You are creating abnormal anatomy by doing that. If you're not treating the root of the problem at the base of the metatarsal, your chances of a recurrence are much, much higher. Okay, so again, this is a simple bumpectomy where they just shave the bump off, and this is a Austin bunionectomy or distal metatarsal osteotomy, which is very, very common today. So this is a postoperative X-ray of an Austin bunionectomy, and as you can see here, the first metatarsal head has been shifted over, and it's fixated. The problem with this is you're creating abnormal anatomy again. Now you have a crooked bone and the foundation is still unstable. That results in a much higher chance of recurrence. This is typical for a LAPIPLASTY procedure. So if you can see, what we're doing is we're actually correcting the bunion from the foundation, from its origin, which is at the base of the tarsal metatarsal joint, of the first tarsal metatarsal joint. So now you can see the metatarsal tends to line up correctly. It's parallel to the second metatarsal. So with a LAPIPLASTY procedure, really any patient who has a bunion could potentially be a candidate for 3D bunion correction. And that includes teenagers, that includes elderly patients, depending on their overall health and really what their needs are. With a LAPIPLASTY procedure, we're not just shaving bone and we're not just taking the bump off, but we're actually correcting the deformity at its origin, which that decreases your chances of recurrence significantly. And that's really down to about 3 to 5% with multiple peer-reviewed studies which show that. Most patients are able to walk within days of surgery in a cast boot. Then we transition patients to tennis shoes at the 6 to 8 week mark, and then release to full activity at 4 months, and that includes high impact running and things like that. So if you're suffering from a bunion deformity and you want to fix it right the first time, schedule an appointment with me, Dr. Lindow, to see if you're a candidate for 3D bunion correction. Give us a call at 225-754-8888. Thanks so much.